We're ready, Sir President.
All right, thank you. So good evening, everyone. And thank you for joining us in our fourth in our mental health series. And tonight, of course, we're going to be talking about COVID-19. I hope everyone is doing well. And on behalf of the Albany, New York Alumni Chapter of Delta Sigma Theta Sorority Incorporated, I want to thank you all for thinking it not robbery to take the time out on this Wednesday evening, this rainy Wednesday evening, to spend time with us listening to our panel of experts. I guarantee you that you are going to receive information that many of us think we already know, but there's always more to know. So I want to thank our Mental Health Committee for bringing us this fourth in their series of mental health events. And I ask that everyone just sit back, relax, and take in all of the information. And with that, I will turn it back over to the committee. Welcome, welcome, welcome.
Good evening, and before we get started, I would just like to remind you that this meeting is being recorded. My name is Benita Lewis, a member of the Technology Committee from the Albany, New York Alumni Chapter of Delta Sigma Theta Sorority Incorporated. I would like to make everyone aware that all participants on the call will be muted. If you have any additional questions during the presentation, please click or tap on the screen and click on the chat box and type your questions in the chat. Please understand that we will be monitoring the chat. If there are any questions directly pertaining to technology, we will answer it. If the question pertains to the topic, we will forward them to the presenter. I will now pass it over to the emergency response team. Thank you.
Welcome to our Delta Sigma Theta community event. We are delighted you chose to be with us today. We want you to have a wonderful experience. Please be assured your safety as well as your enjoyment of the event are our utmost concern. Please take a moment, look around and identify the nearest two exits, whether in a virtual setting at your home or physically in some formal venue. We must always be Delta ready. So please identify two exits in your current location. In the event it is necessary to evacuate quickly and orderly, in case of the need for an emergency evacuation. Also, during this COVID-19 pandemic, please remember to wear your mask, wash your hands, and always walk and stand 6 feet apart from others. Please enjoy the event and continue to be safe. Welcome.
Good evening, everyone. So my name is Bohema Pinto-Smith, and I am co-chair of the Physical and Mental Health Committee of Delta Sigma Theta Sorority Incorporated, the Albany, New York Alumni Chapter. And I'm so happy to have you all here. So I'm a firm believer that for us to be able to take care of ourselves, we have to stay knowledgeable. And it takes work to stay knowledgeable, especially about something that keeps changing, like COVID-19. So a lot has changed in the last few months. So we're hoping that this evening, we can learn a lot from each other, learn from our great panelists. We have people here from different fields that have done so much concerning COVID-19. So we're gonna learn tonight from each one of them and from each other via discussion. So first, let me introduce to you our moderator for the night. So our moderator for this event is Dr. Christine Pluviose. So Dr. Pluviose received her Bachelor of Science in Biology and Secondary Education from CUNY City College in New York City, a Doctor of Medicine from SUNY School of Medicine Biomedical Sciences in Buffalo, and served as a resident physician at Albany Medical Center in family practice. From the onset of her career, Dr. Pluviose's path to medicine was unconventional, led by her unwavering belief for healthcare equity and access, girded by education and fearless advocacy. Dr. Pluviose has had varied roles in clinical administration in the private, public, and New York State civil services sectors, and she has successfully managed clinical care outcomes and led key changes to ensure sustainable resolution outcome for patient care delivery and resource management. The framework of her accomplishments rests on the mantra to educate, empower, and explore. She is an active member and holds committee roles in various organizations, including the MC Loudon Civic and Culture Club. She is an active member of her church, St. Joan of Arc Black Apostolate Catholic Church. And last but not least, she's a proud member of the esteemed Delta Sigma Theta Sorority Incorporated. So let's welcome our moderator. Thank you, Dr. Pluviose.
Dr. Pluviose, you are muted.
Dr. Pluviose?
Dr. Pluviose, you're muted.
Okay.
I unmuted myself.
We're going to do a whole series on muting and unmuting. There we go. Thank you.
You are now unmuted, Dr. Pluviose.
Hi there, I'm sorry. I was muted, I think by the panel. So good evening, everyone. Thank you, Dr. Pinto-Smith, for the introduction. And again, welcome everyone to tonight's conversation on, is the COVID-19 pandemic really ending, and the impact of this in our community of colors? Tonight, we present to you an amazing panel of professional experts who will set or reset the tone for a welcoming, a fact-driven, non-judgmental discussion of COVID in our Black and Brown communities. And where do we go from here? So really tonight, bring all of yourselves. This is a non-judgmental platform for us to have concrete conversation of facts, and also to break down some myths, and to move forward in terms of where do we go from here, and what do we owe to ourselves and our community members in really being on the other side of this COVID battle. So first of our panelists is Dr. Janice Pryboon, and I'm going to read a brief bio from Dr. Pryboon. She is a board certified, Harvard-trained pediatrician and certified marriage and family therapist with additional training in Christian counseling. She earned her Doctor of Medicine at Harvard Medical School in Boston, Massachusetts, and completed her residency at Johns Hopkins University Hospital in Baltimore, Maryland, and Georgetown University in Washington, D.C., where she was recognized as the most outstanding teaching resident. She received her undergraduate degree in biology with honors from Barnard College of Columbia University in New York City. Dr. Pryboon is a specialist in pediatric obesity whose career spans over 40 years. Dr. Pryboon has worked in the Capital Region of upstate New York for several years and was awarded Physician of the Year Award in 2015. While practicing in the South, Dr. Pryboon founded Strong Me Incorporated, a family-focused weight management program which continues to provide counseling to families. She is a proud member of the Albany and Troy NAACP and the Links Incorporated. She is a lead member of Macedonia Baptist Church's task force on COVID-19, where they have helped to get some 700 people of communities of color vaccinated in the Capital District in the spring of 2021. Thank you, Dr. Pryboon. Next is Dr. Katrina Bird. Dr. Katrina Bird is a board certified in internal medicine and adult infectious disease. She completed her undergraduate studies in microbiology at Xavier University of Louisiana and her medical degree at Meharry Medical College. She pursued residency training in internal medicine and pediatrics at the Medical College of Wisconsin. Following residency training, Dr. Bird moved to Rhode Island to pursue subspecialty training in adult and pediatric infectious disease at Brown University. Throughout the course of her career, Dr. Bird has been dedicated to addressing health disparities, particularly in communities of color. As a result, She participated as an infectious disease expert in over 15 informational sessions throughout the US that were targeted towards providing education on COVID-19 and COVID-19 vaccines to communities of colors between January 2021 and May 2021. Her work on COVID-19 vaccine advocacy work through churches has gained local and national media coverage, including a featured article in the Providence Journal, appearances on Good Morning America, What You Need to Know, and The Race, a national political show. She is also passionate about infectious disease and is dedicated to sharing her knowledge on Instagram, YouTube, and Twitter, where she is a proud patrician, say that 3 times. Presently, Dr. Bird is completing the pediatric portion of her infectious disease training, where her research focuses on evaluating the impact of COVID-19 in adults living with HIV and engagement in healthcare for pregnant women living with HIV. Thank you, Dr. Bird. And last, but certainly not least, is Dr. Wanda Katala-Huguley. Dr. Juana Katala-Huguley holds her doctorate in theology at Mid-Hudson Bible Institute. She also holds a master's in theology and social work. She serves as a deacon at Macedonia Baptist Church. Dr. Katala-Huguley is a proud member of Delta Sigma Theta Sorority. Dr. Catala-Huguley's personal and career life has been one of assisting people. She is the career counselor. Her career spans over 45 years, where she has worked over 15 years as a social worker in the Albany School District, over 10 years as a counselor in various roles for the state of New York, over 20 years as a financial planner. As a retiree, her work did not stop. She continues to educate and help register people for the COVID-19 vaccination and to spread awareness of COVID-19. She is a proud mother of 5 children and grandmother of 7. She loves to visit her native Rhode Island home, travel, and spend time with her grandkids. Please welcome our wonderful and illustrious panel of amazing experts who will, again, just reset our thinking, allow an amazing platform where we can share ideas, share facts, break down myths. And again, the goal is to move each and every one of us along in this world of COVID-19, or this post-epidemic world of COVID-19. So what we're going to do now, we're going to open up the panel for Dr. Pryboon will provide a PowerPoint presentation just to level set on some basic facts about COVID-19 and how it affects our community of colors. Dr. Pryboon?
Thank you for that wonderful introduction. And I am so delighted to join the Delta Sorority this evening. I really appreciate the offer to join you. It's just an honor and a pleasure to be here. So this PowerPoint was actually put together before the May 13th announcement by the CDC that we could in some ways remove our masks. So I think it's an excellent topic that you've presented this evening, which is, can we remove our masks? And if we do, how might we do that? How may we safely do this? So this is kind of, as you said, the background music to what we're talking about this evening. So I think you're in control of my slides, so I'll have you go ahead and move forward. So you probably know our president has decided to reopen that can about how did this terrible tragedy of a pandemic begin. As you remember, it was in the Hubei province. You probably heard that there were several lab people that were sick in November of 2019. So the question of, did it jump from a bat to a human? Did it start in the lab? The questions remain, but we remember it was in Hubei, it was in China, and unfortunately there was some politicization of this disease, which probably contributed to the horrendous death rates that we saw. But we as African Americans, as communities of color, were unfortunately tremendously impacted by this disease that had its origin in China. Next slide, please. So what do the numbers tell us? So if you look at American Indian communities, Alaskan Native, hospitalization rates, you'll probably remember, were very high for communities of color, 5.3. These are older numbers. The numbers are a little bit better, but they're still unfortunately disparate. And African Americans, Hispanic, again, approximately 4.7 to 5 times the hospitalization rates. look at our death rates, anywhere from 2 to 3 times death rates in African Americans. Next slide, please. So looking at the numbers again in tablet and a table form, look at the 4.7 higher, 2 point under African Americans, Hispanic, American Indian. Next slide, please. Why are we so disparately affected by this disease that had its origin in China? Next slide. Underlying health conditions certainly play a role. Diabetes, hypertension are key. Obesity may have a role in that. Where we work, the type of work we do, we're often essential workers. I'm from Brooklyn originally. If you think of the mass transit, subway systems, packed in cars, long train rides, long working conditions, packed working conditions. All as in the beginning, we thought this disease was droplet transmitted. We know it's a respiratory droplet. So we're anywhere where we congregated for long periods of time, where we would breathe the air in poor ventilation, we were more likely to pick up the disease. So in a rural community, you're going to see less prevalence, less incidence of disease. Where we were more likely in cities where people were packed together, where there was mass transit, where you had long working hours, where you were a frontline worker. If you had diabetes, hypertension, underlying disparities to begin with, it shined a light on unfortunately, on the disparities that we knew already were in existence. Next slide, please. So crowded situations, unfortunately, with poverty, disparate racism, as we know, close physical contact, enclosed spaces. And I've worked, because of my travel history, I've traveled and lived all over the country. In areas where there's affluence, you could separate. If you had one family member, you could live 3 floors above. If you lived in one apartment and you had one toilet, if you flushed a toilet, you aerosolized the virus. If there's one toilet for everyone to use, if you didn't know to close the lid, the virus would aerosolize and the entire family could become infected. So enclosed spaces with poor ventilation would increase the risk that the entire family would become infected. So duration of exposure, again, closed, small community, small physical spaces, small living quarters, and constant contact and long working hours, which could increase risk. So we saw tremendous death rates and infection rates in large cities and areas with close physical contact. Next slide, please. So how are African-American children of color affected and ravaged by COVID-19? Next slide, please. So unfortunately, the numbers remain high. We had hoped that this would improve, but an article that just came out in Pediatrics just this May of 2021 still shows disparity among Hispanic and African-American children. We unfortunately have much more disease in terms of, you probably heard of MIS-C, where there's an inflammatory condition, multi-system inflammatory disease among children. That rate is still higher among African-American children and children of color. We still have, unfortunately, disparate rates of children who are hospitalized and who die. The rate of disease in children is smaller, fortunately. There have been approximately about 180 deaths in children. The rate of hospitalization is only 1.7% of the adult population. So gratefully, children are less likely to be infected. Children rate of infection goes up as you head toward the teenage years. So children are less likely to be infected, but if those children are going to be infected, they're more likely to be children of color, children who are of African or Hispanic or American Indian descent. What seems to play a role is obesity. And unfortunately, with the pandemic, the rate of obesity has actually continued to climb, if not higher than it was pre-pandemic. Just had a new article that was published. Next slide, please. And that, of course, is children are indoors, they're less likely to play because of the pandemic, they're more likely to be on the computer, they're eating more processed foods, they're less likely to get access to fresh fruits and vegetables, so this is contributing. So what can we do? Again, this slide is pre-pandemic, the advent of the vaccine and the new mask, wearing masks for children. As you know, we are now approved for children 12 and above, but under 12 children indoors, and the new rules with camps, masking is still necessary for children because the vaccine is not yet approved. The vaccine will probably be approved for children from 5 to 11 in the fall. but they will still need to wear masks. We still need to social distance for them. It's 3 feet now for children in school. Practicing hand hygiene is always important. Surface cleaning is not as strict as we were in the beginning, again, because droplet is less of concern, it's more of a respiratory. Staying home if you're sick, which is I try to make a list of all the good things that have happened with COVID, and the list is small, but one of them is the right to stay home when you're sick. Prior to that, I think, especially in medicine, it was never okay to stay home if you were sick. But now, at least, if you're sick, we know you need to stay home, and the potential and the need for testing is important. Know your risks and protect yourself. The importance of vaccine, of course, we'll talk about. Avoid interacting with large groups, of course. Vaccine, of course, will protect you, and the infectious disease will cover that. And just choosing, of course, outdoor activities because of ventilation. The importance of good ventilation can't be understated. And putting off the need for healthcare now that we have the vaccine and the risk of decrease, we're expecting a tsunami of health disease because people have put off their routine healthcare because fear of catching COVID at the hospital and at their doctor's office. So the importance of ramping back up again and getting good healthcare can't be overstated. Next slide, please. So I can't, the freedom of having the vaccine, the importance of it is just, it's just been a wonderful, as a pediatrician, having gone through some pretty horrendous vaccines over the last 40 years. This has been just a great one in terms of lack of side effects. I've seen children who have had some pretty bad vaccines that have had seizures and have had terrible fevers and irritability. This one, I'll take the sore arm and the headache and the aches and pains and down for a couple of days. So it's just been, of course, life-saving. Millions, as you know, have been vaccinated and we've had minimum side effects. We've heard some concern with myocarditis. There's, of course, background noise with myocarditis. We see it in the summertime with teenagers. We see a level of myocarditis. So we're watching that. There've been some new reports out of Israel with young men, so we've got to keep an eye on that. But the signals and the watching of side effects is important. Next slide. So we have to look closely at our guidance. We have to pay attention to infections. We have to pay attention to masking. As you may know, there are lots of people who will get the vaccine and there is no take. They can have a B-cell disorder. They cannot, they can get the vaccine, but they unfortunately do not get good titers to it. So not everyone who's vaccinated will get a good result. Not everybody can get a vaccine. So there is still a need for masking infectious disease. I'm sure we'll go over that. Next slide, please. So we have to know our risks. We have to stay updated. As Dr. Pluviose has said, the data is always changing. We need to get vaccinated. We need to be as free as we can be with knowing and recognizing our limitations, especially protecting our children, recognizing that our children, if anyone else's children, are at greater risk. So we do what we can to protect our children because we know our children are the greatest children at risk. So we be safe because we need to be safe for our children. Thank you.
Thank you, Dr. Bird. Thank you. Does everyone hear an echo? Okay, must be me. So again, just to reiterate, that last slide, I think is a slide that we all need to just have as a mantra, not only for ourselves, but for people in our community, is again, know what your risks are, stay informed, stay safe, and get vaccinated. And that last slide pretty much summarizes where we need to be at all times. So Dr. Bird, can you tell us a little more about the different vaccines that are available and what and if there are any differences among the vaccines that are available?
Yes, thank you for having me. I'm really excited to be here. So if you don't mind, I'm just going to take 15 seconds to take a step back and maybe talk briefly about how vaccines work.
Absolutely.
So when we give vaccines, we know that from history that vaccines, when we're having an infection that's out of control, that vaccines do a really good job controlling, either eliminating or controlling the disease. So for example, when was the last time you saw someone with smallpox? You probably haven't because we eliminated it in the 1970s as a result of vaccines. When was the last time you saw someone with polio? You probably most likely haven't, because that's another disease that we've pretty much controlled with vaccinations. Vaccine, when you give it to the body, this is what happens. So let's say I get the COVID-19 vaccine. What is happening is that vaccine is stimulating my body to produce what we call antibodies. Think about antibodies as little soldiers in our immune system. So they just build up, they ramp up, and that's when you may feel the sore arm or have a little bit of fever, because it's all your body kind of ramping up and getting ready to protect you. So if you are exposed to COVID-19, then your body already has that army of antibodies to fight it off. This is why we give vaccines. So to answer your question, there are 3 COVID-19 vaccines that are available in the United States. 2 of them work a certain way and 1 of them works a different way. So Pfizer and Moderna are what we call mRNA-based vaccines. The overall arching thing I would like for you to know is they work essentially the same. You give the vaccine to the body, the vaccine goes to specific cells and produces, and the body ramps up those antibodies or those soldiers to protect you. The other type, and those are the vaccines that are given twice. So for the Pfizer, you have to get it's 28 days, it's 21 days between the first and the second shot. And for the Moderna, it's 28 days between the first and second shot. So those are the 2-dose vaccines. The other vaccine is the Janssen or Johnson & Johnson vaccine. It works a little bit differently between the Pfizer and Moderna. I can go into a lot more detail. However, it works the same way in that it's injected into the body. It stimulates the body to make those antibodies or soldiers in order to protect you. And that is just 1 dose, like you just take 1 shot and you're protected.
Dr. Bird, thank you so much. In what you just described to us, can you talk a little bit more about the safety of these vaccines? If there are any differences of the safety of the 3 that you discussed? Is one safer than the other? Can you talk a little more about that?
So in general, the safety profile is very similar. So I'm gonna take out the Johnson & Johnson. I'll talk a little bit more in detail about that one in a second. So these vaccines haven't been associated with death. I know some people are really, really concerned about that. And there have been some celebrity cases, but to our knowledge, and the CDC is monitoring this closely. It hasn't been associated with death. The most common side effects are fever, just like Dr. Pryboon said. You may have soreness at the site where you get the injection. You may have a little fever, headache, maybe body aches. Majority of these symptoms go away within the first 48 hours after getting the vaccine. And so the Johnson & Johnson, for the most part, is the same, except for there have been studies that have shown that people pass out, or we call that syncope, after getting the Johnson & Johnson vaccine. We aren't sure if that's related to the vaccine itself, or if a higher number of people who are afraid of needles are getting the Johnson & Johnson vaccine and are getting kind of anxious and scared. I personally believe it's the latter. It's a lot of anxiety around getting the vaccines. The other point that I wanted to make in regards to safety, a lot of things have been spoken about regarding the Johnson & Johnson and the blood clots in the brain. So initially that was reported in women. The initial patients were between 18 and 49. They presented with a severe headache beyond that 48-hour mark after getting vaccinated. They also had low platelets, or these are the cells that help the blood clot when it needs to clot. So we still aren't 100% sure what the mechanism or how the vaccine is creating this situation. This was something that was noticed. The other thing that Dr. Pryboon mentioned was myocarditis. We actually saw a few children come in with myocarditis. So let me just explain what that is. So basically, it's swelling or inflammation in the heart to the point where the heart doesn't pump as well as it should. A lot of, when we're thinking about infections or vaccines, most common are like a viral infection. So it's usually a post-infectious, meaning that it happens after you had infection. Sometimes, and we aren't 100% sure if it's associated with the vaccine, but we did report our 2 cases that we had here in Rhode Island to the CDC.
Doctor, we do have a question in the chat. Can a vaccine and/or antibodies help with having positive impact on other autoimmune conditions?
So this, I would say, I'm not sure if it will have any effect on any other autoimmune diseases. So I just want to remind you that this vaccine is very specific. The scientists made it very specific to SARS-CoV-2, which is the name of the virus that causes COVID-19. So it is, when you get the vaccine, it only produces these soldiers or antibodies against the virus that causes COVID-19. It's not meant to have other interactions. I don't think that it will cause any other autoimmune, either worsen or improve any other autoimmune conditions. However, we'll have to see, because these are relatively new. So more studies and more will be out there.
Great, thank you. Dr. Bird, thank you for that. So you touched on some of the short-term side effects from the vaccinations, ranging from fever, discomfort at the site, perhaps a fainting episode. Specifically with the Johnson & Johnson, there is the risk of, some risk of a blood clot development post 48 hours of the shot. Can you talk to us a little more about some of the long-term side effects of the vaccines, either yourself or Dr. Pryboon?
I can just start. So when we're thinking about vaccine, most likely if you're going to see a long-term side effect, it's going to be within the first 6 weeks of getting the vaccine. To be honest, we don't really know the long-term side effects because we've only started giving the vaccine, since December. So given that people, like for myself specifically, I got my initial shot in December, and I personally haven't had any long-term, side effects. So I think that we're gonna have to wait and see. Given that people have been really tolerating the vaccine well, I don't anticipate that people will have any long-term side effects.
Okay.
Dr. Pluviose, there are additional questions in the chat.
Okay.
When will we know if the 2 doses are enough and we won't need a booster annually?
I think this is tricky. I'm hoping, I don't know for sure. That's a short answer to your question. I'm hoping by the fall we'll know. The issue is I'm sure you probably heard of variants. So the longer a virus is in a community, the higher the chance of it mutating. So I think of viruses as very fashionable, things. So what they'll do is like, oh, okay, you have a vaccine, you're trying to create an immune response against me. Okay, so now I'm going to change my outer coat. I'm going to change my configuration. So now you can't recognize me. So this is how these are what we call variants. And the reason why that's important is because eventually we'll start developing variants that the vaccine won't cover. At this point, at least here in the United States, the overwhelming majority of variants are being covered, or the vaccine will protect us. However, time will tell if we unfortunately get a variant that circulates in the population in which we'll need a booster shot. So that's the idea of the booster vaccine. So we're not sure. Hopefully by the fall, we'll have a more definitive answer.
You probably know there is now a variant in Vietnam that is a cross between the British and the Indian variant. And Pfizer has done antibody studies up until 9 months. So as Dr. Bird said, we're looking, of course, to hope it lasts the antibodies at least a year. So they'll look at a year's time and see, like the flu, when you do your annual flu shot, we do surveillance to see, well, what is the most likely flu virus that we need to be protected against. So whatever variants are in the globe for that year, we may have to do a booster for whatever new variants have popped up. And so if there's a lot of disease anywhere in the globe, none of us are fully protected. So I think it was an excellent question, is the pandemic over? It's not over until the disease is wiped out across the globe. So whenever, for myself personally, wherever I'm gathered with a lot of people who I don't know their vaccination status, I'm putting my mask back on, because we don't know if they just got off a plane from Vietnam, and are they carrying a variant that I don't know that my Pfizer vaccine is actually protecting me against, because we don't know enough about the variants yet. And wherever there's a heavy load of virus, right now in the Capital District, we're doing really well. So we're up around 54% for everyone has had at least 2 vaccines, and close to 60 plus for one vaccine. So we're almost approaching herd immunity in the Capital District. So we're doing well, but people do travel to the Capital District, and they do get off planes in the Capital District. So if they've traveled somewhere and they've gone somewhere in an area where they're very low vaccinated, they could bring in a variant. So when I'm in an area, I'm eating dinner with people I know are vaccinated. I'm in a church service where I know everyone's pretty much vaccinated. I'm comfortable. But where I'm in a place where I don't know where you've been and where you've traveled, and I don't know your status, I'm not reading it as the pandemic is over, because until I know that I don't need a booster for the latest variant in India or Vietnam or Saigon or wherever it may be popping up, until the globe has, just as Dr. Bird said, with smallpox, with polio, these are diseases that were pretty active when I was a young kid. So this disease may not be eradicated. It may only be kept at a standstill. So there may be a year or 2 or more where we still have to consider masks. So I just would caution all of us to just be careful to keep an eye out for variants, and to be aware that, as I think it's an excellent question, we may have to be on the lookout for boosters, not so much because it didn't protect for the 6 variants we know about, but for any potential ones, because there's such a high load of disease, not in our country, but across the world, that we unfortunately can't address at this moment.
Thank you, Dr. Bryd. And that reiterates our message of remaining safe, and staying informed and remaining safe. And also and not to mitigate COVID-19, but think about the flu vaccine. That is what works behind the flu vaccine. Every year there's thousands, hundreds of thousands of variants, and every flu vaccine every year covers a little bit more. Hence, we keep the death rates down from the flu, right? Because the flu kills too, but we have eradicated to a certain extent. But again, we also know there are variants, and that's what boosters do. That's why the annual shots, that's what it protects us from. So that's probably where we're moving with the COVID-19 vaccine. But again, just as Dr. Pryboon and Dr. Bird stated, there's a lot more to be researched and a lot more to be investigated when it comes to that. So I'd like to turn this now to Dr. Katala-Huguley. You got vaccinated, but you did share with me that you were a bit hesitant initially to get vaccinated. Can you share with us briefly your hesitation and why? And where do you stand now in terms of, your message to people who may be hesitant about being vaccinated?
Sure, but before I do, let me please thank Delta Sigma Theta Sorority for Albany Alumni Chapter for allowing me to serve in this capacity today. And certainly, I feel privileged to be on a panel with both Dr. Bird and Dr. Pryboon. And for Dr. Bird, you are in my home state. I'm a native of Rhode Island. I just came back from there yesterday, and I hope you are loving it as much as I do. And now to answer your question. So I'm not a medical doctor. My doctorate is in theology. So I know nothing about medicine, but I do know how to pray. And, you know, during the time of COVID, I spent a lot of time praying because I live alone and we were all isolated. You couldn't get out. My friends were dying. My family were dying. And then I heard that the vaccine was coming. It's coming. It's coming. But I'm just an ordinary person who is a senior citizen. So I remember hearing about the Tuskegee syphilis experiment. And I remember hearing about the Puerto Rican women who they experimented on for birth control. And I was honestly quite worried too, because I'm a person of color and often mistrustful, just like everyone else. And I thought, you know, this is just one way maybe of getting rid of us again. But then I began to do research. I prayed and I got research. And I read about Dr. 34-year-old Dr. Kismeka Covet, who 34 years old from North Carolina, who led this. And she'd been working on virus stuff for 6 years, since 2006. So this was really exciting to me that I had a young woman, younger than my kids, who have been studying and was a leader in this path. And I thought, you know, God is good and he has brought us full circle. We've always been knowledgeable, but now we can share that knowledge as a people. We've always been knowledgeable, but now we have masses. And for the first time, a Black woman that I knew of could save my life. And so I said to my kids, you know, I have had friends when I was little who had polio and who walked with crutches. I remember getting measles, mumps, and rubella shots. You know, I remember those things as a kid because, again, I'm a senior. And maybe and I used to tease them. I said, I might not have any fingers and I might not have any toes after I had this vaccination, but I'm going to live. And so that's what inspired me to do the vaccination.
Great. And did you have any side effects?
None, absolutely none. So I'm a diabetic. I have needles, you know, blood taken out 4 times a year. And I always feel them taking it. And so when I went into this room, just to share, I still was a little mistrustful. So I was watching to make sure there wasn't a needle for us and a needle for them. And I saw just one box of needles and we were all getting the same needle. So as she pulled the needle, you know, and she put the thing in there, I said to her, so let me know when you get ready to do it, because I have to watch you because I'm really afraid. And she said, well, you can't watch me because I'm done. I didn't feel it. I went home waiting and waiting and waiting for some side effects. They never came. And then I heard people say, well, that second shot is going to do it. You know, the second shot is worse than the first. And the second shot came. And again, for me, there were no side effects. For my daughter, she was tired for a day. My daughter-in-law had a headache. Everyone in my house is vaccinated. And really, there were no major things to speak of.
Thank you, Dr. Katala-Huguley. And I think you made a great point, which is, again, you can go from 0 side effects to the minor discomfort of the fever, the fatigue, sleepiness, and, you know, the soreness at the site. But this opens up a great conversation, and I think every one of our panelists can probably give us discuss this a little further. Can you talk to us about some of the myths that are surrounding the vaccine? Because that, first and foremost, is a deterrent for many of us to get the vaccine. So can each of you guys speak a little bit about the deterrent? I will turn this over to anyone on the panel.
Well, I guess I'll go first and I'll talk about, you know, in 1931 when the Tuskegee group, they gave these men syphilis and they watched them. They didn't give them any medication because they wanted to see what was going to happen. And our men suffered. And, you know, I think we have been used more than once for research and to no avail to us. to no benefit to us. When I think of the young woman in Miss Lax, who had cancer, and they took her blood cells from Johns Hopkins, and that was $1 billion research project. And she died, and her family received no benefits from it. There are just so many times that things like this have happened to people of color, that it does tend to keep us just a little bit fearful. But again, through education, through the media, we didn't have the media like we have it today. Things are on the media before people know it now. So it's more difficult to do the kind of things that were done just out there in the open a few years ago.
Thank you, Dr. Katala-Huguley. Dr. Bird or Dr. Boone, would you like to add to that?
I have a few. So I'm just going to mention 3. There are so many. Well, one myth is that if I get the COVID-19 vaccine, it will give me COVID. And this is 100% untrue, because we're not even injecting you with the virus. It's just a little bit of material that helps your body promote those antibodies or those kind of immune soldiers that's going to fight infection. So people keep really perseverating the point that, if I get COVID-19 vaccine, they're injecting the virus into my body. And people do mention the Tuskegee, and people are really nervous about, like, they mention, they gave the people syphilis and stuff like that. And so those, which they actually didn't give the men syphilis, they enrolled men who already had syphilis and allowed them to spread it throughout the community because they were just observing them. So that's what happened. But, so many stories and so many bad memories from that example. And thank you for bringing up Henrietta Lacks, because that was an issue too. So that's one. The other one is women in particular. I feel we have a number of women in the audience are really nervous about fertility. Like, they feel that the vaccine may cause them to be, infertile. And this is just unfounded. There's no evidence that this is true. I know someone personally who got vaccinated and who is now pregnant. And she got pregnant pretty quickly. So as soon as she tried, she got pregnant. So it's like, it's not going to cause you to become infertile. And the other one that's another common, myth is that people just really, the last one, if I'm healthy, if I take my vitamins, if I take my tonic, I'm not going to get COVID-19. I promise you, your vitamins, your tonic, the fact that you work out 7 days a week, the fact that you eat salad and all of these things will not protect you against COVID-19, period. And people really do think that if they are 100% healthy and have a clean diet, that this will protect them against COVID-19. And I'm here to tell you, I've seen many people who are very, very, very healthy and still get COVID-19. What happens, and the dangerous part of this, is young, healthy people get infected and they typically have no symptoms. Or if they have symptoms, the symptoms are extremely mild. Maybe they have a little runny nose, that's it. Or maybe they have like just a few symptoms. And what we're seeing is they're going to, go visit a newborn nephew, or they're going to visit their elderly mother or grandmother. And those people are getting sick to the point where they're being hospitalized. I've taken care of children as young as 2 days with COVID-19 from well-meaning people who, were spreading the virus and didn't really have many symptoms. I've taken care of elderly people who, some of them have subsequently died in the hospital, all because, so-and-so, was infected and didn't have symptoms. So these are the things that we really need to encourage our young people, especially people between 18 and 29 years old, to really get vaccinated, because that group don't feel like they are going to get sick and rather take the risk. And they're really thinking about themselves and not about the population as a whole.
Yes, I want to just say that Dr. Juana is such a vaccine warrior. So she just, I don't know how many people she signed up, how many people she led by the hand, how many people she got to the vaccine site. I lost count, Juana. How many people you called on Saturday, Thursday, Friday night, lined up, got them there. Give me your arm. We got it done. Whatever fear, whatever myth, you're like, we're gonna talk. It was, you resolved it. It was like, I'm gonna put you on with Wanda, Dr. Wanda, she's gonna work this through. So I'm just trying to think of all, let's see, you're gonna change my DNA. There's no DNA in the mRNA, it's an RNA. There's no interaction with the nucleus of the cell. It's degraded, certainly within days to weeks. It only lives in your arm. It doesn't invade the rest of your body. It just is, that's why your arm is so sore and the lymph nodes around your arm get sore. Infertility, let's see, what's the other one? Long-term effect, as Dr. Bird said, we don't have any, but it's degraded. It's like any vaccine. Any vaccine is within 4 to 6 weeks and the vaccine is gone. So you think of it like any other vaccine. There are no, what long-term effects do you have from your vaccine? Once you've had your vaccine, it's over, it's done. So if you haven't had a side effect, the odds of having one are not there. And again, I take comfort in knowing that Kizzy made the vaccine and she started in 2006. So I feel comfortable that she's done this work and she's African-American. So it's a vaccine. So I've been doing vaccines for 40 years. And if you haven't seen, I got mine in December. If I didn't see anything within 4 to 6 weeks, I don't expect to see anything. My body has been working. And I think someone had a great question about immune system and immunological issues with the vaccine. You really do have to see if you're under the care of an immunologist or rheumatologist. If you have an underlying immune disorder, you do have to work closely with your immunologist or rheumatologist because the vaccine does need to have a competent immune system. And if there are any issues, you don't know that you have a good take. And that's all the more reason to wear your mask. And it's very difficult to do titers against the vaccine and against the disease itself. It's hard to interpret the titer, so you really need to be under expert care. So the vaccine is just unreliable in the presence of any immunological problem. So if you have an autoimmune problem or immunological problem, you need to be under expert care. So I think that's outside the scope of this panel to address that, but only to say that you would want to be under expert care because the vaccine is unreliable in the setting of autoimmune disease or immunological problem. But it does not interfere, but may not be reliable. And as Dr. Bird said, you just can't rely on it because it doesn't really, it's designed for one purpose, to make you respond to the COVID-19 virus, and that's it. So in that case, you need to, again, you can't measure, you can only measure the titer of the virus. You can't tell if your immune system is responding in kind, if your immune system may not be 100% up to par. But I want to thank Dr. Juana for her great work and getting so many people vaccinated while our numbers are so high in the Capital District.
Absolutely.
But there are a lot of myths, and I haven't had one I couldn't, with good data, you can't counteract. Infertility. A lot of them are, it's just like the flu. Well, that's good for white people, but that doesn't work for us. So it may be like the flu, and as Dr. Bird said, for young people, it may be like the flu, but if you go home to Black people, you may be killing them. So it doesn't work, depends on who you are and who you're going home to. So if you're living in tight quarters and you got one toilet, you got one apartment, that may not work really well. So if it's just like the flu, it might be okay, depends on where you live and who you live with and how long you work and what your circumstances are. So for us, it's a killer. So we have to think long and hard about what we do and how we want to live with or without this virus and for how long. And the vaccine works. It's a safe vaccine relative to my 40 years of experience. And it's worth for me the risks were small compared to the value and the freedom that I got. Not to say I'm out of the woods, I'm not. but it's certainly a lot better living than I was a year ago. I lost my sister to it. I lost a lot of friends. I can't afford to lose anybody else, but my life is certainly a lot better with it than without it.
Thank you so much for great remarks from our panelists. And again, I cannot overstate that last slide that you had, that you shared with us, Dr. Boone, which is to know your risk. You've got to know your risk. You've got to stay informed, stay safe, get vaccinated, and really following those 4 mantras will help us move this needle along and address everything that we've discussed so far. What are the different vaccines? What is the advantage? What are the myths? Being able to have that conversation, excuse me, with your loved ones about what do these myths mean and do they really apply to us? So if you just can stay around those 4 points to, again, stay informed, to know your risk, be safe, get vaccinated, we can get ahead of this. So at this time, I'd like to move along and talk about, we've kind of dwelled on the adult population. I'd like to move forward and let's talk about our children. And you've touched upon it in terms of, we do have the vulnerable population between the 18 and 24s, and it's just the way it is in terms of that's the age where, you're immortals and what have you. And let's talk about that population group, but also more importantly, let's talk about the school age group, because there's so many changes happening now. We do know as young as 12-year-olds, they can get vaccinated. And we're hopeful that between 5 and 11, the approval will come in, FDA will approve the vaccination of that group come the fall when school reopen. Now, with the reopening of school in the fall, we are most likely shifting from virtual to in-person. Is it a safe idea? What are some considerations that, as parents, that we have to keep in mind to keep our children safe? What are some practical tips that we can continue to practice at home and at school, again, to stay ahead of this COVID-19? Dr. Boone, I'll open that up to you.
Well, I think the hard one for families is masking to stay consistent, because until the vaccine is available to children under 12, it's difficult to do as I say, not as I do. So trying to be a real good role model is to continue to mask for them and to continue to be a role model. When you're at home, of course, you're in your own circle, family circle, and that's different, but once you're outside, to continue to mask with them. And social distance is still in play. Schools, as you know, has dropped to 3 feet. There's a good study that just came out in New York City public schools. The rate of transmission in schools is very low. So schools are actually a pretty safe environment, which is reassuring. Children, as Dr. Bird will probably speak to, fortunately have played a low rate of transmission. So they have been a safe cohort for us, which has been a blessing, that they have not been a big source of disease. And they have not been tremendous carriers, which has been wonderful. So I think good hand washing, continuing to be good role models for them. And we've kept them relatively safe. Their death rate has been low relative to 595,000 Americans lost, and we've lost less than 200 children, which is still too many. But relative to that, I think as Americans, we've done well by our children. We've had about 1,000 MIS-C inflammatory disease, children who've gotten inflammatory multi-system disease. And we've had about 2 million children get COVID out of, I think our numbers are in 33 million Americans have gotten COVID. So as Americans, we've done pretty well to shield our children. So I think we continue to do what we're doing, get vaccinated, continue our hygiene, our distancing whenever we're in public, continue to mask with them and protect them until they can get vaccinated.
Dr. Bird, would you like to add to that?
Yeah, thank you, Dr. Pryboon. You are absolutely correct in regards to young children don't really transmit well the virus, but let me go into a little bit more detail. So when you're thinking of babies, toddler, pre-K, elementary school kids.
Frozen.
Oh, hello.
Hi.
Okay, can you hear me?
We can hear you. You were frozen for a quick second, and maybe on my end.
Oh, sorry. So I just to go back, when you think about kids who are elementary school and younger, they really don't transmit COVID-19 well. There have been multiple studies, including a Korean study, that kind of showed this. The majority, and when I say they don't transmit well, it's like in school settings, they don't transmit to each other well. And it's relatively uncommon for a child in this age range to make an adult sick. The majority of the time for our elementary school kids and younger, they are getting COVID-19 from teenagers and adults. So that's why it's important to continue to mask to protect those, your loved ones who are in that age range. So that's one point I wanted to make. When we talk about teenagers, just think like as you get into those teenager years, you start having the adult size, which includes adult lungs. So they transmit better. And so that is, I'm very, very thankful we're able to give vaccines. The last point I wanted to make is I have seen a lot of cases of MIS-C. What I typically see is they're usually children as young as 2 years old, sometimes as old as 10, some older, but just that's the general age range that I've personally seen. They come in devastatingly sick, fever, body aches, stomach pain. You know, a lot of them are so sick they have to go to the pediatric intensive care unit because their blood pressure is so low. Some of them have very bad breathing problems where they have to be on a breathing machine. So they get very sick, and that parent is at the bedside, oh, you know, very frantic. And I'm thinking like, I don't want a parent to be in that position. I've seen many parents cry. I've really had to reassure many, look, your child is going to be okay. We know how to treat this, so forth and so on. So if I can do anything to prevent a parent or a caregiver being in that position, that's what I want to do. That's why I do these types of talks. So that is why it is important. When you think about getting the vaccine, we want you to think about yourself and we want to protect yourself, but think about your baby. Think about your grandkids. Think about the kids that you're going to be around to protect them. We cannot predict, just like for an adult, we know certain risk factors for having really bad disease. For children, we can't predict which children are going to have that really bad MIS-C or multi-system inflammatory disease. We don't know. And so when you think about, do I want to wear this mask today? Or do I want to get vaccinated? Please think about your children.
Absolutely. So this brings us to our main question, and it really it's around vaccine hesitation. So with 50% of the population now vaccinated, do we have more information and data to encourage those who are not vaccinated or who are still hesitant? And what have each one of you, what can you share with us in terms of what have you done in terms of your immediate circle, family and friends and members of the community? What do you tell them what's the conversation like for those who are hesitant about being vaccinated? And how do you address that? So Juana, I'm going to start off with you. Excuse me, Dr. Catala-Huguley. I will start with you. And maybe you can, in answering this question, you could tell us what have you done in terms of working with the community, for those who were hesitant about vaccinations.
Okay, so I told you that I was hesitant, and I shared why I decided to get vaccinated. And then, I'm the kind of person that, once I do something, I do it with my whole heart. I either don't do it or I do it with my whole heart. I jump right in. And so one of the things that I noticed is that many people my age and of color are computer illiterate. So the system was set up so that initially that you had to, do all this computer stuff in order to even get an appointment. And when I saw that happening, I went to my soror, Christine, and I said, Christine, help me out. So I started funneling names of individuals and people's information to Christine. And she would do it. She would do all the computer work. So thank you, Christine. She would do all the computer work and then send me back an appointment, and I would send that appointment on. And so people started calling me and saying, Juana, can you set me up an appointment? I heard you did it for so-and-so. And that's how I began. And then I also noticed that when I took some of my friends or other people, there were more white people there than Black people. There were more white people there than Puerto Ricans. There were more white people there than brown people. And so that kind of disturbed me, since the whole goal was for Black and brown skinned people. So I went on like a campaign at that point, you know, we've got to do better. You've got to do better. And everyone that I saw, I just started asking them about vaccinations. And I'm sure I was on a lot of, including my kids. Every one of my kids are vaccinated, because you can't come to my house unless you're vaccinated. And I tell people that I can't see you unless you're vaccinated. I was in Rhode Island yesterday, and 2 of my nieces are not vaccinated. They couldn't visit me. And then my church formed a partnership with other churches in FEMA. And so Dr. Pryboon and I and another woman, Miss Meriday, were together in coming up with names, compiling a list, getting the appointments for individuals. And so I continued to do that. And when I got to the point where I didn't have anyone else, I started asking my kids for their friends and their friends' mothers and their friends' fathers. And that's what I did. And now I'm worried. So I guess the question you asked was, so what happens now? I'm a little worried, because we are on our honor as a country. If you have been vaccinated, you no longer have to wear a mask unless you're going to a school or hospital, and then you know the list. That worries me, because so many of the people who refuse to be vaccinated have no honor, as far as I'm concerned, because it's not about your life, it's about the life of everybody else. And so I worry that if people do not continue to get vaccinated, and if people begin to go out in the public without mask, that the pandemic is going to come back. So that's how I feel about that. And that's my worry. And I pray that, we can convince more people, continue to get vaccinated, that I'm concerned about the population between 20 and 40. She said younger, but I'm hearing 20 to 40-year-olds saying, I'm not doing it. I'm waiting for herd immunity. There is no herd immunity if 70% of the people don't get vaccinated. And right now, this country, we're not at 70%. So that's my worry.
Thank you, Dr. Katala-Huguley. Before I move on to Dr. Pryboon and Dr. Bird, let's talk a little bit more about what are some of the best practices for family vacations? As we've all mentioned and we all are aware, we are open. We're pretty much open, and globally things are opening up for multiple reasons, whether it be for fiscal reasons and or for just folks are just tired. They're COVID tired at this point. What, Dr. Bird or Dr. Boone, what are some suggestions or guidelines that you can touch upon in terms of vaccinated adults traveling with unvaccinated kids?
So I actually I live in Rhode Island. I traveled to Detroit. Oh, I'll talk about domestic travel first, and then we can talk a little bit about international travel. So if you're vaccinated, you don't need to get a COVID-19 vaccine, COVID-19 test prior to being leaving or upon returning in most places. So it's important to continue to really wear the mask. I would say in airplane, I would wear 2 masks. I would double mask to give you more protection in the more crowded airport and airplanes if you're on the bus, so forth and so on. But at the end of the day, I would say do your best to do the mask. I think that's going to be the number one thing you want to do. Really try to avoid areas where the COVID rates are really high, like over 5%. You really try to avoid those places. Really try to avoid knowingly being around maybe family members who are unvaccinated, because they can, even if you get the vaccine, you can still get sick from COVID. The vaccines, we hope that you don't get sick at all, but the vaccines are designed to prevent severe illness, hospitalizations, and death. So you have to, that's one thing that is important to distinguish. Regarding international travel, I am very conservative, probably because I've seen a lot of people die. I still am personally nervous about traveling internationally, but I understand people are trying to live their best lives. So I would, if you're going to travel internationally, I would really try to not travel to places where COVID rates are high. For example, India. Like I would avoid those places and really abide by the COVID-19 testing regulations and masking in those places. I believe internationally, you still have to get testing before and prior to coming back, depending on the place. So I would recommend just abiding by those. But to be honest, the very conservative person in me is like, please don't go internationally. But I know that this is a personal bias because I've seen so much COVID, and I understand that people don't feel like me.
Dr. Pryboon, would you like to comment on this question also?
I want to pick up on what Dr. Bird said about, I was just looking, trying to see what the latest numbers are, but there've been about 10,000 COVID infections post-vaccination. So being vaccinated doesn't absolutely, again, there've been about 130, I think, 130 million vaccine doses given. So that's a very tiny, tiny number of people that have had breakthrough infections. And of those, it looks like there are about 140 deaths. So being vaccinated gives you a lot of protection, but it's not foolproof. So traveling to some place like India would not be a great idea. So I would not travel internationally at this point in time. There are very few countries. New Zealand is not going to let you in. So the countries that have very good rates are not letting Americans in. It'll be very tough to get into a country that has done a very good job controlling COVID. They're just not going to let us in. They don't trust us. I don't think at this point that they're going to let us in. So I would stay away from the South personally, unless, you know, again, I would stay only in areas because their numbers, their masking and their rates of vaccination has just not been tremendous. So I would be very careful where I go in the South and some of the states in the West. I would really check their, I like it under 3% if you can, but 5% is reasonable. So I would check local vaccination, and I'm with Dr. Juana. If you guys are unvaccinated, I'm not sure about eating in your house or going to eat with you. So I do ask, and you probably saw the article in the Times Union about HIPAA rules and asking verbally. You're not asking for a little exchange of medical records, but if you just ask people about their vaccine rates, we're not breaking any HIPAA rules. So I usually ask. And then if you can't, where we live is wonderful. So hiking and outdoor activities are perfect. So if you can take your children, and you probably know the new camp rules about masking. So if you're outdoors with your children and you're in your family circle that you know is healthy, your kids don't have to mask. If you know that your adults are vaccinated and safe, and your kids have been in that family circle and in a healthy circle, and you're outdoors, you're in a healthy, again, enclosed environment, outdoor environment with a healthy inner circle, then you know your kids are safe. So mask them when you're around people you don't know their vaccination rates, and keep them outdoors. So I would do Lake George, hiking, outdoor areas where the ventilation is good, and I would stay in areas where it's 3% or less. And I would check, I would know and eat outdoors as much as possible, and watch the ventilation as much as you can.
Well, thank you. Very helpful. I think I can say on behalf of the audience, our panelists were just amazing in providing us, again, facts about COVID, where we were, where we are now, and where are we going. But the bottom line again, and I will reiterate this, again, to borrow from your slide, Dr. Pryboon, first and foremost, know your risk. And in knowing your risk, it's knowing, you know, Dr. Pluviose, you know, what are my health risks? What are the health risks of my loved ones? You know, and making decisions accordingly around that. Staying informed. Having conversation, make it a daily routine, make it a comfortable, a natural thing to have conversations among your loved ones in the communities. Make it a normal thing to talk about COVID. That way more of us can be informed. Stay safe. You know, that is a definition. Everyone has to define what that safetiness feels like. It may mean that, you cannot have dinner or gather with your loved ones that you're used to hanging out with. Work within each other's circles, work within each other's safety zones, within each other's comfort zone. Get vaccinated. We cannot underscore this. Yes, the vaccine is not an end all be all, but it certainly can give you an advantage. And that's what we're looking for, is an advantage to stay ahead of the COVID-19 disease itself. It's not an end all be all. We're not at that place where it's completely eradicated, as is evidenced by the different strains that are popping up. But there are a lot of behavioral things that we can do to mitigate our risk, to lower our risk. And we owe that to ourselves and to one another. But again, thank you so much for our panelists. At this time, I would like to turn over to the technology or the Dr. Pinto-Smith. If there are any questions in the chat that we have not covered thus far, to please share that with us, and we'd be more than happy to share it with the panel.
Yes, if anyone can please, if you have other questions, please put them in the chat. It looks like we've answered most everything. So there were questions about the booster, or would there be a need for boosters, and we don't know yet. It's feasible if it's similar to flu that it could be, but more to come. There were questions about if you're immunocompromised, what that means for you, and that's been answered. That's also kind of a black box and more to find out. So you definitely need to speak to your own provider because you're in a special group if you're immunocompromised when it comes to COVID. Let's see. Those were the biggest questions in the chat.
May I just add one thing about the immunocompromised? So I take care of HIV positive patients. So in that group, we are recommending COVID-19 vaccine unless your CD4 count is less than 200. And someone with HIV knows what that means. So in general, for a lot of our, it all depends. Specifically, the immunocompromised state is important because we want your immune system to be healthy enough to create those antibodies or those soldiers against the virus, not that the vaccine will make you sick. So I just wanted to put that out there.
There was a remark that was made about the variants that we've seen a few in this country, but more in other countries. So there was a comment that perhaps that is the reason, the variants, why all countries should do all that we can to assist those countries that are vaccinating their citizens at a slower rate. That was thrown out there as something to chew on.
I agree. It is hard for us because we have such needs here, but an outbreak anywhere is an outbreak for all of us. So, and to pick up on Dr. Bird as well, it may not be that your immune system may be compromised, but sometimes your medications may be compromising your immune system. So also, if you know you're on a medication that's compromising your immune system, also talk with your doctor to make sure that they feel if you're on a high dose prednisone, if you're on a medication that may be compromising you, so that you got the vaccine, but you feel comfortable that you actually got a good take on the vaccine because of your medication. It didn't compromise you.
There was a question about that. It was reiterate. I have asked if I have to get a Moderna booster, if my vaccine shot was Moderna, and I think that's still unknown. Whether it's Moderna or Pfizer or J&J, is all unknown whether you will need another booster in a year from your first shot, etc. Is my understanding. But.
Yes, they're actually studying that, especially in people with autoimmune disease. They're wondering if they need to do an adenovector vaccine with an mRNA. They're wondering if they have to cross them in order to get a booster. So that's actively being studied if you have to do a crossover or if you have to stay with the same vaccine.
Good point. Well, thank you, everyone. It is now 7:21 p.m. We've actually, it seems like we have had a full discussion and are ending a little early, but please do not let me rush anyone. But I would like to point out that there is an evaluation form that's in the chat, so please, feedback is wonderful. You only know how good you are based on feedback because it gives us an opportunity to do better and be better. Tonight's discussion was great. Again, I cannot thank our panelists, Dr. Pryboon, Dr. Bird, Dr. Catala-Huguley. Thank you so much for, just giving us a platform, allowing us a platform where we can be informed, we can talk about facts, we can, ask questions, not be judged, and bring all of us, and really leave here with a sense of obligation to help one another and to be part of the change that is needed, not only within our small communities, but also globally, to move past COVID-19. And, let us, toast to a new year, this post-COVID pandemic year, and let's make it a good one. So, but what we ask is that, again, know your risk, stay informed, stay safe, get vaccinated, keep having the conversations. And we thank everyone for participating in tonight's discussion.
Thank you.
Thank you. Madam President, did you have anything to say to end the call?
No, I just want to thank all the panelists and thank you to everyone who attended tonight. This was great. Lots of information. And as I said, there's always something more to learn, and I certainly learned a lot tonight. So thank you all for sharing. Be well.
Thank you.
Thank you.